Hey, counselors, life coaches, if you've been wondering about getting into the addiction field, you need to watch this video now about the Certified Prevention Specialist. Check it out. Hi, I have Nicole Augustine here. I was amazed trying to schedule a session with you on your Calendly. It's like, you might be the busiest person I've talked to in a while.
Yes, I do love calendars for scheduling life.
Yes, being a boomer, I'm not quite there yet. My partner, Julie, is, and she scolded me. But, it's a, how is it they put it? It's a process, not an event.
That's true.
So, Nicole, welcome.
Thank you. Happy to be here.
So I wanted to reach out to you for a bunch of reasons. I just started working with a prevention specialist as I'm her clinical supervisor. And it's one of those things where, will you be my supervisor? Everybody said no. And I'm like, sure, why not? How hard could it be? Oh my God. So before we get to the nitty gritty on prevention specialist, can you tell us a little bit about yourself, your background, and what in the world got you into this?
Yes, absolutely. So my background is in sociology. That's where I started as an undergrad. And I went from there into public health. But what happened in between is after I graduated from college, I got the opportunity to do college underage drinking prevention in a university space, which was focused on harm reduction. This was a brand new topic for me. I really loved it. I learned about motivational interviewing, and I felt like for the first time I was doing something that was really helpful and constructive. You talk to folks who most have never even had a conversation with their parents or an adult about alcohol, and they get on these college campuses. Everyone else is just throwing back the alcohol, so they figure that's what I should do also. They'd come into my office and I'd be like, well, let's talk about this. Are you really getting what you want from your experience? And most of the time they weren't. They were having blackouts, they were getting sick, they were being hungover. And so I'd say, well, if you learn more about alcohol in the brain, you can consume alcohol in a way that reduces your harm, even short term, but definitely long term in terms of addiction. And it was the first time people had had a true productive conversation about drinking. You know what I mean?
I do.
And that's what got me into public health. I started looking at the people around me because I was barely making any money. I was an intern. I was poor.
Yeah.
I was like, how do I make more money? And someone's like, you need a degree. So I ended up going into public health, and that was a wonderful experience. It opened up my eyes to so much about prevention, about public health, and it's just kind of been something that I've been into. I personally have a history with it from my family, and that I ended up being raised by my grandmother because my parents both dealt with addiction and couldn't raise me and my sister. So it's always been a topic that was kind of close to my heart and my experience, but we never talked about it. I never knew why or what it was. It wasn't until I got older that I started to get into the field of public health to learn more. And it's just been a passion of mine. I feel like if we talked more about this in society, people would have more positive experiences instead of the other side that happens so much, which is preventable. Addiction is preventable, and most people don't even know that.
It's probably the single most preventable public health situation. What got me interested, I've been interested in prevention for a long time, but lately I have my own harm reduction practice. So I do coaching and harm reduction. And I had one, extremely successful male in his 40s. Nobody had ever told him about the health consequences of alcohol, or if he had been told, it didn't register. Mm-hmm. Mm-hmm. And my position is we should do everything we can to prevent the situations from escalating, so that they don't have to have their insurance company, or they spend hundreds of dollars an hour and go through X amount of therapy and all the therapy. Definitely a huge fan. Mm-hmm. Your answer gave me a couple rabbit holes if you're into them.
I love rabbit holes. Let's go.
So I guess I'm going to go with my last question first. Prevention, I don't think, is widely understood within the addictions field. I think there is very little understanding of what the Prevention Specialist Credential is, who should be doing it. And I'll just tell you, sociology and public health, thank you, because we need people with a different perspective than drinking is addiction, addiction is bad, you have to stop using the rest of your life, which is the traditional way of doing it. So from a sociological perspective, you mentioned that you're doing harm reduction, showing people how to use substances responsibly. That's heresy to a lot of the folks that I work with. Can you give us a little more background on how that works or examples?
Yeah. So and to speak to the heresy part, I didn't even know what I learned was heresy until I moved. So I went to school in New York. I learned under people who were in the harm reduction space, motivational interviewing. So to me, it was prevention. I didn't have that language. I moved from New York to North Carolina, and it was like, whoa. What are you talking about here? It's abstinence. It's abstinence. It's abstinence. You know what I mean? And I was like, wait, what? So I had to go to a different part of the country to realize that what I learned, people weren't calling prevention. So to speak to your point, right? For me, what it means is we have lived long enough now to have the science of the brain, to truly have enough people who have experienced addiction, to be able to have longitudinal studies that tells us the progression of addiction over time. And so much so that we're really able to completely let go of the old thinking that it has to do with morality, religion, willpower, okay? All this stuff that makes it seem like if you become addicted, you're a bad person. We know enough about the science to know that that is heresy. The challenge is there hasn't been enough education to general everyday people for folks to not still hold that belief system. And so the challenge is people still think that if you use drugs, you are going to become addicted. There is no other thing, right? And it's this huge polarity, so much so that we're not even taught the warning signs. So I give a perfect example of where we've done this is heart disease, okay? You could probably almost ask anybody, what are the warning signs of heart disease? And or the risk factors, right? They'll tell you, oh, if you smoke, if you don't eat right, this, and that. And people will actually talk about the things they could do to reduce their risk. Well, we know the exact same thing about addiction, yet no one's taught it. So instead, people move through their life experiencing the early warning signs that are completely ignored until you get further down, because addiction takes years, decades sometimes before it really significantly impacts a person's life. But by the time you get there and seek treatment, heck, I mean, the level of dependency that happens around there makes the treatment process so much more challenging than if you took a prevention perspective and actually intervened way earlier in the person's experience, you know?
I do. And that's actually one of our core functions. And I'll get back to this. So one of the core functions that I teach people that are internships is client education. And that education piece is borrowed heavily from the prevention. The only difference is now we're using the same things as relapse prevention because they've already crossed that threshold. Folks, in case you're wondering, it's a lot easier if you deal with some of this stuff earlier.
So true.
Question, so you mentioned that you had college students coming into your office. Was it inevitable that they had a slight drinking problem that they would automatically follow the disease trail? Or were they able to stop without going to further counseling, coaching, etc.?
I would say the majority of folks were able to reverse what was happening because they were so early in the stage that it was merely just a matter of changing small behaviors and small patterns. I had very few people who, after meeting with me, then had another, because it was connected to having an on-campus violation. Where the first time you had a violation, you'd come and talk to someone like me. And for most of the students, they'd be like, oh my God, this is like so helpful. They just changed how they were drinking and, never had any issues, if you will. Of course, you have some people who are further along, who may have been drinking since they were in high school or even middle school, to which, then a part of the prevention space is being able to what we call identify a potential person who needs to move on to a screening for treatment to actually determine whether or not they're a little bit further on in the disease, right? And those situations would happen sometimes too, where someone would come in my office and be like, okay, this feels a little bit beyond my scope of intervention, that something more needs to happen here. But again, because I was dealing with young folks, it was still pretty early on, that was more rare than the just typical high risk use that was happening for people.
One of the biggest concerns I have on my side of the fence is overdiagnosis and overtreatment. And I think the population at large thinks if you have a drinking problem, now you have to go to rehab, or, spend 28 days inpatient or months and months, where I found studies show that roughly 80% of anybody diagnosed with a substance use disorder is going to be mild. And that mild just needs entry-level interventions. Plus, like 60% of the junior class of any given college is going to come up somewhere with 2 or more criteria. Most of them can be handled on the prevention space.
Mm-hmm. Very, very true.
Thank you for that. Now, the reason I was so excited to get you on here is I kind of feel like I'm interviewing a rock star before they hit it big.
Yes, I love that.
I've read this book. So you come into the prevention space. What was did you become certified in prevention, and what was that process like for you? Because, clue folks, there wasn't a lot of material when you first came into the field.
No, not at all. So I decided to get certified in 2015, actually. And for me, it was one of those things, I'm a nerd and I love learning. So I was like, well, if I am doing this addiction prevention, I want to make sure I'm doing it right. I'd done some research. I saw that there was a certification, so I started studying for it. And actually, before I started studying, I started talking to some people to see how come, because I could barely find anyone around me who had the certification, but yet tons of people were doing prevention. And what I found is that quite a few people struggled to find resources to study, and when they did take it, they didn't pass.
I've heard that the failure rate, I don't want to discourage anybody. Let's just say it's the reverse of the 80-20 rule.
Yes.
So you come into this space. What kind of material did you find? I know there's one textbook that costs $120 through a company that it's a textbook and it's written for a master's level student. Yeah. So you had to digest and find this stuff on your own, or go to the Rhode Island website and the Vermont website.
Yeah. No, you're right. I mean, it was pretty scarce. And so you're right. The Prevention Specialist exam has the highest failure rate of all the credentials. And what I discovered, the main reason that happens is because people are doing prevention without having studied it or knowing there's a science behind it. And in fact, general society doesn't even think it's a science. So that's one of the problems there, right? And people think, oh, I've been doing it. I can just take an exam and pass it. But you would never think that about the MCAT or GRE. You know what I mean?
But absolutely. Well, with the MCAT and the GRE, you can take the practice exams and kind of figure out the formula. But if you take a practice exam over and over again for an IC&RC test, there's only one thing I can guarantee you, and that's that question isn't going to be on the exam.
Right.
What in the world compelled you to go ahead, take the bull by the horns, and write this beautiful text? That had to be a journey and a half.
It was a journey. Oh my gosh. So for me, it began with the fact that I wanted to pass the exam myself. And there were 4 other colleagues at the place I was working. None of us were certified. So I was like, let's start a study group. And we all ended up passing. And what ended up happening with that experience, they were like, look, you are great at like helping people understand concepts, teaching things. There's a need for this. You should really think about writing a study guide. So truly, back in 2015, I started writing this as a Google Doc, okay? In my Google Drive, I was just gathering my thoughts, a little bit of this, a little bit of that. And it's been a document that I've been working on for probably 4 or 5 years. And then what happened for me is actually in 2020, funny story, my sister, I had been telling her about this book I was writing. She was out having drinks.
Oh, no.
In a bar. And one of the women who was there mentioned that she worked for an academic publishing company. So I get a phone call like 10:30 at night. She's like, hey, didn't you say you're writing an academic book? I just met someone. I think they can help you. And I was like, okay. So she put the woman on the phone. I just thought what I was doing. She was like, you know what? This sounds like something that Rutledge would like. I'm going to send you my email. Why don't you contact me? I think this was like on a weekend. I contacted her on a Monday, followed up. I submitted my proposal. It took about 3 months. I didn't think they were going to say yes. It took about 3 or 4 months before I finally heard back, and they were like, hey, we love your idea. We want to support the build of this book. And I got my contract to write it. So I had started it, on Drive, and I had enough information to be able to present a really solid proposal to Rutledge. And so in 2021, I began writing, finishing it up, and I finished it officially December of 2022.
So myself.
21.
Okay, but still, myself and my supervisee are probably among the first cohort that's actually doing this. I've passed all the exams, including clinical soup. I was a college instructor. I've been teaching people how to pass the IC&RC exam for going on 10 years now. Not this. So a prevention specialist has to have skill in everything from epidemiology to how to do a community assessment, how to write a proposal. If you were a young prevention specialist today, how would you go about it?
Wow, this is a wonderful question because you're right. Prevention has such a broad stretch of knowledge you need to know. For me, if I was to start today, given there are way more resources today than when I was doing it, there are a few main places I would go. One would be the Prevention Technology Transfer Center network. This is a network that was put together by SAMHSA, focused on the professional development of prevention professionals. They have a wealth of resources. Some of them focus specifically on certification. A lot of them just focus on the skills you need as a preventionist to do the work. So I would get lost in all of the trainings that they have to offer on that particular website, because you could probably get through all of them and you wouldn't even, it would take you a long time. That's how much content is there. So I would definitely start there. The other place that I would go that I found really helpful was actually the textbook that you're talking about. It was written in the early 2000s, so technically time-wise it's dated. They have not done a second edition, which it's on my radar. Do we need to do a second edition? It's been too long. But I really found that book foundational for me. I read it cover to cover. I looked at the discussion questions. I really dived into the content. And then, of course, I would say, read my book.
Well, yeah, and there's one more key one. Be sure to like and subscribe to this channel because we're going to be doing more prevention work.
Nice.
So let's say that somebody is interested in that they've done everything, they've gotten the clinical soup. What kind of opportunities are out there in your experience for someone with this credential?
Yeah. So truly, I found the sky is the limit. You can do almost anything in prevention. So here's what's amazing, right? Is you and I are applying the science of prevention for addiction. But truly, the science of prevention is based in public health, which means you can take the skills that you learn in prevention and apply it to diabetes, to HIV prevention, pick anything, because the concept that you're going to learn, you can apply to any particular health issue. So for me, the sky truly is the limit because you can get the credential and you can do one-on-one stuff, whether that's motivational interviewing or prevention education with youth or parents, which is where I started. Now I don't do any of that. I sit more in the workforce development space now. There's so much you can do. You know, some people work for the federal government, some people go to the county. I know some people who really get into the business entrepreneur side of it, because really the skill around prevention is needed in society just in general to improve our health outcomes, you know?
What I found really compelling, because here at LeeBella, we provide addiction counseling in North Carolina, but we also do life coaching worldwide. And there are so many coaches that are not qualified, not trained. They shouldn't be in this space, and I'm not afraid to call them out on that. But the legitimate coaches, if you get the Prevention Specialist Credential behind your name, the education you have, the training you have the 300-hour practicum that someone like me does, then you have 2 years of follow-on supervision where you need 1 hour supervision for every 40. I think that the prevention credential is so applicable to so many of us, whether we're addiction counselors, social workers, life coaches. It's pretty amazing. The person I get to supervise is an amazing individual. I'm not going to mention her name. So yeah, she has not even done with her practicum yet. She's a music therapist, certified, and a family life coach.
Okay.
So the prevention just ties everything together.
It's going to be amazing.
Well, like I said, I really appreciate you being here, but here's my favorite question. Is there anything I didn't ask you that you think the world really needs to know about the prevention space?
This is what I'll say. The International Credentialing Board only requires a high school diploma or a GED to qualify someone to be eligible to become a prevention specialist. So to me, I think of this credential as the credential of the people. And if more people, regular, everyday people, had the knowledge of being a prevention specialist, I think we could really revolutionize health. Because imagine if your brother, uncle, cousin knew this. Just in everyday living, we could have conversations about health and wellness in our living rooms, in our cars, in our everyday spaces, because that to me is where the health and wellness and growth of people really happen, not necessarily in the office spaces where we kind of confine it to. So the message I want the world to know is everybody should be looking at figuring out how I can learn in order to become a prevention specialist.
Thank you very much. You're an excellent representative and ambassador for the field. Would you be willing to come on here again? Maybe someday we can follow up?
Yeah, I love stuff like this. I will talk to you anytime.
This has been the most fun. I can't believe I actually do this for a living.
I know, it's great.